Hi, everyone. I'm Stephanie Johannes. I'm a pediatrician and I lead the Medical Advocates for Healthy Air, a program of Clean Air Carolina. And it's a pleasure to welcome Greg Kearney today to speak about the health impacts of climate change. Dr. Kearney is an associate professor and the founding program director for the Doctor of Public Health, Environmental and Occupational Health program in the Department of Public Health at the Brody School of Medicine at East Carolina University. His research focuses on environmental public health problems that adversely affect rural and vulnerable populations. Prior to joining ECU, he served as an environmental epidemiologist at the CDC and in the Florida Department of Health. Dr. Kearney, thank you for joining us today.
Oh, hey, great. Thank you. Thank you for having me. It's a pleasure and an honor to be presenting today on a topic that I feel very passionate about, and I'm sure many of you do. I also like to thank our good friends at Clean Air Carolina for pulling this together. This is fantastic. Every year they do just put together just such a great conference, and with COVID and everybody Zooming, it's great to be able to share this with you from my home. So again, thank you everyone. Today I'm going to be covering some of the health impacts of climate change and really kind of adding some things that I hope you find helpful. I also put two issues of the journal up here, the North Carolina Medical Journal, who have been really good to us. We'd like to thank them as well. They've published several of our articles on climate change and health impacts. And Dr. Kim Lyerly headed up the September-October issue in 2018. And then the most recent one, September-October 2020, there was just a whole lot of folks from North Carolina that contributed to this issue. And so I would ask you, to take a look at that. A lot of the content that I have in my presentation is from that. And it's the best part about it, it's absolutely free. You can go online and you can access the journal and all of these great articles. So I don't have a whole lot of time today. So I'm going to kind of do things a little bit different. I'm going to start kind of in the back, in the rear. And I just want to stress some very important points. And first of all, I want to mention too that the voices from the front line, to hear the youth speaking about the environment and their concern for the environment today was really just inspiring. I'm so glad to hear the youth today talking about the environment and how they're concerned about it. So it's really good. And so that's one of the points I want to make today is the connection between public health and the environment and how it impacts how all of these together and is affecting climate change is affecting our health, it's affecting our environment, and it's important that we pay attention to all aspects of this because we rely on safe, clean drinking water and air quality and biodiversity. So it's very important that we keep that in mind. Some populations will be more affected or are being more affected by climate change than others, and we'll talk about that. And now is the time to really do something about it. Well, we're probably, we're actually past the point, but we really need to implement policies and really have a cultural shift into our way of thinking if we really want to tackle climate change. And I don't want to leave you all with gloom and doom. There's hope, and there's also health co-benefits to changing from our current dependency on fossil fuels, and I'll talk about that as well. So to kind of put things into perspective, I always like to start out with this slide because it shows the amount of fossil fuels that we've been using since around the Industrial Revolution, and this has made some great accomplishments for us in using fossil fuel. But one of the problems is using all this free energy, I guess we could call it, is that it's impacting our environment as well as is impacting our health. So increased human activity is evident from just looking around. The Earth's natural systems, from the Amazon rainforest to some of the plains out in Texas, we can see some of the links that we have to go to actually get some of these natural resources and these fossil fuels to actually use for energy to heat our homes and to, you know, take plane trips and to drive our cars. So we've been doing this for a really long time. And, you know, we've gotten to that point where it's time for us to change our ways. I did want to emphasize too that, you know, looking at this deforestation of the rainforest, you know, that's one of our connections. We're all, you know, living human beings with living cells. The rainforest is a great example of our connection, because many of the medicines and things that we get are derived from these natural resources, and without these natural resources, you know, it jeopardizes our health. So not only is forest good for the environment, for, you know, taking in CO2 and releasing oxygen and giving us clean air to breathe, but it provides a lot of other resources, including biodiversity and is part of the food chain as well. So we've been burning this energy, you know, since around the 1700s, and we've been dumping enormous amounts of CO2 into the atmosphere to the tune of about 52 billion tons every year. Now, it's kind of hard to grasp, but you might be able to understand that we've been actually increased since the 1990s, 40% in CO2 emissions. So, you know, it's just a tremendous amount of CO2 gases that we've released into the environment. And the worst part about some of these CO2 emissions and these greenhouse gases is that they really hang around for a really long time in the atmosphere. They just don't burn off and go away. And so, as we all know from 6th grade science class, the problem with that is the greenhouse effect, because these chemicals hang around up in the atmosphere, and it prevents the radiation that gets to the sun, from the sun to the earth. It prevents it from reflecting back into the atmosphere. And so it really creates a greenhouse or a warming effect. And that's one of the problems that we've been facing. This young gentleman that you see here is Ralph Keeling. You may not know the name, or you may know the name. He's the son of the famous Dr. Charles Keeling, who first started measuring carbon dioxide emissions at Mauna Loa. It's a remote island in Hawaii. So why did they measure CO2 there? Well, it's because there's no really pollution there, man-made pollution. There are volcanoes, but so it serves as kind of a good control point to measure global CO2. And so he's been measuring this. Well, his father was measuring this since 1958. And as you can see, these CO2 emissions have really skyrocketed since the 50s. And if we could even carry this out before, we would see, you know, at the beginning of the Industrial Revolution, how it's increased. One important point I want to make here, though, is these little figures that you see here. These are what they call oscillations in measurements. And so the CO2 levels actually go up and they go down. And I don't know if you're aware of this, but Dr. Keeling, through his measurements, actually found out that this is the uptake and the release of carbon dioxide from plants. So in the spring and the summer, when they take in more because of photosynthesis, and then in the fall and the winter they release. So you actually see a little spike each one of these years. So these years actually follow the season. So without the rainforest as kind of the lungs for the planet, you know, we could see these levels go even higher. So I think we're at that tipping point now where, you know, with more deforestation and increased CO2, we run the risk of even more problems. So as I mentioned, since the Industrial Revolution, these CO2 emissions have been going up, but it also correlates very well with our global temperature. So you see here on this graph that the CO2 concentrations have been going up, and these are the annual mean temperatures of both land and oceans. So it correlates pretty well going up as the CO2 emissions go up. And not only does it correlate well with temperatures, but it also correlates very well with our population growth. So as of a few days ago, the world population was 7.7 billion and continuing to climb. So the consumption of goods and services, plane trips and things like that, we demand more energy, and as a result of using more energy that requires fossil fuels, our CO2 levels go up, and so our population goes up as well. So at some point, we've hit the tipping point, and we need to do something about that. These reports, or the reports you see here from NOAA, is becoming more common. 2016 was the Earth's first hottest year. 2020 was the second hottest year, and we're seeing more and more of these every year. So the Earth has warmed up about 1.5 degrees since around the Industrial Revolution. And as a result, we're witnessing rising sea levels, diminishing Arctic ice, glaciers have shrunk, ice on rivers and lakes are breaking up earlier. We've seen fish and animal migration patterns change because of warming temperatures. And also trees and flowers are actually pollinating sooner because of the longer warming period. So one of the biggest concerns about all this is that the ocean absorbs a lot of the carbon dioxide that's kind of fallout from CO2, and as a result of that, it's increased the acidity or lower the pH of oceans, and so ocean water has become more acidic, and that's not really good for coral reefs and particularly shellfish. It actually thins the layer of the shellfish, their shells. So it creates or disrupts the whole food chain. So that's one major problem. The other major problem is it creates an ideal environment for extreme weather events, because a lot of hurricanes, like many of you know, hurricanes start off the coast of Africa, and they are fueled by warm waters. And so when we have these warmer waters, that's why you're hearing about these more intense storms and tropical weather events. So just a little bit of late news in February, just to give you an idea of some of the warming temperatures of the ocean. This is the first time ever in history that this Arctic channel here has been open. So what has happened is that the ice has melted here, and sea carriers or large barges can access this. So this has never been the case during February, when it's the coldest month of the year. So folks in China who do a lot of import-export, they typically would have to travel around China and around India and up through the Suez Canal to deliver their goods. So, but now, because of this climate change and the warming waters and the Arctic melt there, they're able to actually breach this go through and shave days off of their travel time to deliver these goods and services. It also reduces their costs too, because they don't have to pay to go through the Suez Canal. Now, if you're in the shipping industry, this is great news, right? But we're not all in the shipping industry, and we're a big global planet. And this is really a game changer, because this warming effect is really increasing our sea level rise, and actually, like I said before, is actually impacting biodiversity. So there's many events of these occurrences of these natural or these extreme weather events. There is no new normal. Seems like every day, we see or hear about something unique that's been happening. The flooding in Miami has been going on for a really long time. Not only is it a nuisance to try to get through this water, but they're experiencing sea level rise at a really high rate, and it threatens the Biscayne Bay aquifer, which actually is the water source for most of South Florida. Our summers are getting hotter. We're seeing more hurricanes, more intense storms. Venice has historic flooding in 2019. California and Australia, the wildfires, the heat has a tendency to dry things out and make things burn easier. Australia experienced the worst wildfire, I think, ever in history. And the number was just staggering. Over 46 million acres were burned. But not only that, 3 billion animals with a B were affected, including mammals, birds, reptiles, amphibians. So it's just a huge impact. So this is kind of the money slide, and it's a very complicated slide, because it does involve help. And the reason I included this is because there's really no way to measure climate change on public health. It's a very complicated network of systems that are kind of mediated through these different pathways. And so a really smart scientist, a group of folks, Nick Watts, developed this kind of graphic that shows that climate change impacts health through primarily three ways: through these direct effects, which we see through heat and flood and severe storms. And there's these indirect or secondary effects that are really mediated through ecosystem changes in the environment. And they give rise to infectious diseases that we may be exposed to. And then the third factor that you see here is the social dynamics. Oh, I'm sorry if you saw that. Oh no, I apologize. I don't know if you can see that. Okay, are we back? Okay, we're okay. So then there's these social dynamics, which we refer to as more commonly in public health as the social determinants of health. So all of these factors combined or can impact our health in different ways. We'll talk about that in just a second. So the real point here is that, you know, for a clinician or for, you know, folks that really want to try to make a health case and convincing other people that climate change is impacting health, it's a little bit difficult because there really aren't any biomarkers or, you know, clinical assessments or tests that you can do. You can't take a blood test and say you were exposed to climate change. It's a very difficult thing to do. So trying to explain this is a little bit sometimes difficult, but the CDC made a much friendlier version of what you just saw. And the way this is kind of laid out, if you look at the bullseye, these are the extreme events that are happening as a result of climate change. And with them, they've associated different diseases or different illnesses with different effects. For air pollution, obviously, you know, asthma and cardiovascular disease would be impacted. And I won't go over all of these. This can all be found on the CDC website. But what I will do is I'll tell you that, you know, in general, the direct effect of climate change is these severe weather events that has a tendency to create more increased injuries from people, you know, working on their houses and preparing for storms and cleanup. And then there's fatalities from drownings, you know, extreme heat events. Mostly elderly people don't tend to do well with extreme heat. And then there's the mental health impacts that happen or increase as a result of being faced with these abnormal events. We saw that in Hurricane Katrina and in many other events, including right here in North Carolina, in New Bern and along the coast. We saw a lot of folks with flooded houses that had to live in moldy homes that were really under a lot of mental stress. This slide really kind of summarizes what I've been talking about really well. If you look at the top, you know, these disruptions to ecosystems and the disruptions to societal systems really kind of combine together to create these sickness and injuries. And the end result here that we're interested in today is the human health aspect. Is that people that are more vulnerable, particularly children, older women, pregnant women, and those with disabilities that don't have resources or the ability to do things for themselves, the people that suffer the most as a result of a changing climate. This little cartoon you see here, I mean, I love this because it just summarizes it really well. So if you see on the left, it kind of divides the haves between the haves and the have-nots. So the folks that live on the over on my left, the most responsible are actually the least vulnerable. So in these high socioeconomic status countries like the U.S., where, you know, most folks have a couple of cars, a nice house, and a family, use a lot of electricity, a lot of fuel, and they make the most emissions. Well, in the face of climate change, you know, they can turn on their air conditioning or turn on their heat and stay comfortable and avoid some of those impacts. Whereas on the other side, you know, folks in the lesser developed countries or who have less are the most vulnerable. They don't have a whole lot of resources. They don't generate a whole lot of CO2 emissions. They have really minimal impact on the planet, but they suffer the most because they don't have money to, for air conditioning and heat and for increasing food prices. This kind of drives this home a little bit. So if you look at this map, you'll see that those countries that develop or have the highest CO2 emissions, like I mentioned, the North America up here, or Canada and the US and Australia, they are some of the highest emitters. But countries like that you see here in Africa, they have very low emissions. Some of the countries here don't even have electricity, or they're just getting electricity. So they have very minimal impact. And then you can see here, it's illustrated here that they're highly vulnerable to the impacts. So even to take it a little bit further, to illustrate here, you can see here that these people that live in Africa, primarily in the Republic of Congo, which was formerly Zaire, and Papua New Guinea and India, they live right along the equator. Now, you remember from science, Tropic of Cancer and the equator. This is the hottest, most humid place on the planet. So with climate change, this is only going to get hotter. These are among the poorest countries in the world, and they are actually going to suffer the most because of climate change, particularly here in Central Africa, where they already have a high mortality rate, child mortality rate. There's premature death, high rates of malaria, malnutrition, diarrheal disease, heat stress, and there's other tropical diseases that this just endemic. And the kind of the exacerbating factor for that is that they have a very weak healthcare system and structure. So if someone is sick and ill, they usually don't have anywhere to go for help. So those are definitely among the most vulnerable globally. And the outlook doesn't look much better for Africa either. If we look at this growth chart through the century, we can see that, in North America and in Europe, we see a little bit of an increase in population. Asia is really high, but it plateaus and goes back, somewhat to a lower level by 2100. But Africa, on the other hand, its population is projected to increase from about 1.3 billion people to about 4.3 billion. And so with these inherent problems that they have now, the future does not look that bright. So here in North Carolina, it's not just your imagination that it's getting hotter. We're seeing hotter summers. We're seeing warmer nights annually. And this slide came from the North Carolina Climate Science Report, which maybe a lot of you that are here today online watching this or participated in this, and thank you for doing that. But we're seeing much warmer temperatures, and this really gets to a lot of different issues, but notably farm workers and outdoor workers tend to suffer greatly, disproportionately among rising heat. And there's some really good work that's been done by Ashley Ward, Maggie Sugg, looking at some farm workers in heat here that you see down in Sampson County and Bladen and those areas. They saw some really high heat-related illness. And there's an earlier MMWR CDC report that came out that actually listed North Carolina as having the highest heat-related deaths among crop workers over about a 7 or 8 year period. So North Carolina is really seeing its share of this. We're also seeing more increased annual rainfall, and with sea level rise, it's increasing nuisance flooding, which means just a little bit of rain causes floods in our streets, and it makes it really kind of aggravating to get around. And then when we have a really big storm surge or really big hurricane event, it impacts us greatly. And just to note here, in just the last 6 or 7 years, I didn't put all of the hurricanes and the storms here, but we've seen tremendous damage to some of our communities throughout North Carolina. New that you see, Ocean Isle, and then Princeville, which is historically a very historical African-American. It's actually the first African-American community established. And my good friend Bobby Jones is the mayor there. And you know, he's been through this twice, went through it with Hurricane Floyd, went through with Matthew, and you know, he's just trying to get some relief every time they get these huge storms. I mean, the whole town just goes underwater. As I mentioned before, some of these stories about what's going on locally can be found in the North Carolina Medical Journal in this issue. So I want to touch on rural populations, particularly here in Eastern North Carolina. Climate change is going to be, it is a problem for a lot of Eastern North Carolinians, primarily because of our geography or our topography. We're not very high above sea level, which makes us prone to flooding. We have a lot of estuaries, rivers. So when we get some heavy storms, everything tends to flood. And for people that are living inland and on the coast, you know, that have septic systems and drinking and private drinking water wells, when we get these floods, it damages, it creates damages and threats to our drinking water, also to our homes. So it's a really big problem. People that live in the rural areas in Eastern North Carolina, they have further distances to travel for food, medicine, school, so they rely on transportation. And when the roads are washed out or they don't have communication, it makes them very difficult to be able to get resources or to get help. So it's a really concerning problem, particularly for rural, isolated communities. I put this picture here. This is Enfield, North Carolina. I don't know if anybody is familiar with that. It's near my hometown. And it was once recognized as the world's largest raw peanut market. And it was just a booming town. As a kid, I remember this. But because of a lot of the economics of this type of business, mills and factories, a lot of things have moved out. And so there's a lot of Eastern North Carolina towns like this that are just really struggling to get by. And having another problem like climate change impacting crops and agriculture, and it's just a really big problem. Again, here's a little bit of projections for North Carolina and what we might see in the future. And things just seem to be continue to be getting wetter and hotter. And I'll just leave it at that. And if you'd like to see the climate science report, again, that's a free document too. Bill Gates says he has a plan, and I was interested in this, so I kind of read through the book, and you know, it's kind of interesting to hear a billionaire, you know, telling us how to solve problems. But you know, that's good. I'm glad he's on board and he's thinking about that. We need a lot of folks to advocate for climate change, but it's an interesting book. Bill Gates has proposed some really unique inventions. One is zero carbon cement. Cement manufacturing is a really huge emitter of greenhouse gases. Food tracking to actually track our waste food. And then these energy storage facilities like you see here. This is one out on the ocean, which makes a lot of sense actually. You know, you put these solar panels out on the ocean, and they collect energy, and then we use it. So anyway, it's I thought this was interesting. I thought you might enjoy seeing that. The latest, so I was going to mention something about COVID, because I have to say something about COVID, because there's actually a lot of similarities between COVID and CO2 in terms of vulnerability and the populations that it affects, but I don't have time to go into that here. So I will just mention this particular point, is that there's been several studies that have been coming out that are really, and because of the lockdowns that we had globally, people staying at home and working from home, less plane trips. Some scientists actually measured CO2 emissions and actually saw a decrease of about 8.8% from January to June of 2020. This is really, you know, just phenomenal. This was like a natural experiment that kind of happened. So it shows, you know, if we do change our behavior and we change the way we do things, you know, we can actually make a difference. So, you know, trying to move us towards more sustainability has a lot of benefits. It's not necessarily making folks, you know, grow their own tomatoes, weave their own moccasins, and live by candlelight, as like I always like to say. But there are some changes that we can make that actually are good for the planet and good for ourselves. So supporting walkable communities where people live and work in the same place, like you see up here in the top, actually reduces our dependency on transportation, automobiles. Obviously, you know, going to more natural-based energy sources like solar and wind, which is this right here in North Carolina, is amazing. Switching over to plant-based diets or plant proteins is another way to reduce our dependency on using animal proteins, which I didn't mention it, but animals also produce methane, which contribute to greenhouse gases, and that's a whole nother topic that we won't get into. But you know, riding bikes and eating more fruits and vegetables and walking more is just a great way to improve our health and as well as, you know, help our planet. We are seeing a cultural shift in our attitudes, which is really encouraging. And yes, I think a lot of this is driven by politics, but it actually looks like, you know, for this year, for 2019, the Americans in this survey by Yale University, and they do this every year, they send out this survey, and then they model some of the data. We actually saw the people that who think global warming is not happening was actually 5-to-1 for those who didn't think it was happening. So this is encouraging as well. So we hope that we can keep these numbers up. And then this is my last slide, and I'll leave this with you. So I'm a host parent for Nancy that you see here. Nancy's from Chengdu, China. Her population of her community is about 10.2 million. The other children that you see here also go to her school. This is my son Tanner. So we're a host family for Nancy. Nancy's been living with us for 3 years. So we have the kid. I say kids. We have them over. You know, every so often we have dinner and we play games. And so the first time they came over, we were in the backyard, and I live out in the country, and I look, and they're all looking up with their phones, you know, and they're taking pictures, and it just really surprised me. So I asked them. I said, what's going on? What are you doing? And they said, well, we're taking pictures. And I thought maybe it was a satellite or something. But they said they were taking pictures of the stars because, in Beijing and Shanghai, so much pollution, it's an everyday occurrence. They never get to see stars. So it was, just for me, it was kind of a climate justice moment because, children should not have to grow up not looking, having to wait to get to a certain place to see the stars. It should be a right for everybody to enjoy a natural environment. So. And with that, I thank everybody for your attention. Stephanie, you okay?
Thank you so much, Dr. Kearney. That was a wonderful introduction to the many, many health impacts of climate change. And we have only, well, we're just at time, but I want to pass along one question that we got from an audience member. So if there was one thing that health professionals could do to address the climate crisis, what would that be?
I would say the top thing they could do as a health professional is talk to a policymaker, is to be passionate about this issue and convince a policymaker why making this change is important.
Great, thank you so much. We are just about at time, so we're going to have to skip the further questions, but thank you again. And I want to remind everybody that you can go back to the Whova app to choose a breakout session for the next session. After that talk, you'll go back to the Whova app again to choose your second breakout session. Thank you all.
Oh.